In this section, we're going to talk about one example of an international public health surveillance system. And the scope of public health surveillance systems varies. Some are truly global in nature, some are regional, some are national, just within one country, some are even at a state or provincial level, some are even more localized than that. Really, if you think about how you choose, it depends on, where you're going to act. Do you want to act at a local, state, national, regional, or global level? It depends on the problem that you're tackling. But in this example, we want to talk about an international system and one that is conducted at a regional level, in Europe in particular. So we're going to talk a bit about the European Antimicrobial Resistance Surveillance Network. It's called EARSnet for short. And the link to the site for EARSnet is below. So you can go on at the website and see all of the information about this incredible network there. The first iteration of this surveillance system began in 1998, and currently there are 30 European countries participating. So just imagine the scale of that. Antimicrobial resistance is important because these bugs, as the name suggests, are resistant to many different types of antibiotics. Antibiotics are important treatment for curing these infections. So when we find bacteria that are resistant, this is an important public health problem that we need to address. And because they're easily transmitted across country borders, it makes sense for many countries in Europe to work together to track and monitor the spread of these infections and try to come to agreement on how to combat them. So overall, the network's objectives are to collect comparable, representative, and accurate antimicrobial resistance data, to analyze temporal and spatial trends of AMR in Europe. Recall that we're interested in who is being infected, when, and where. They want to provide timely data for policy decisions. Recall that action is very important in public health surveillance. They want to encourage the implementation, maintenance, and improvement of national AMR surveillance programs. So you have a regional network that has as one of its objectives to specifically improve the surveillance at the national level and support those programs. And they also want to support national systems and their efforts to improve diagnostic accuracy by offering annual external quality assessments. So again, in support of national programs, they band together all of these countries to help improve the quality of the overall surveillance. So what kind of data do they collect? So laboratories from those 30 different countries share results from the cultures that they grow and the bacterial isolates they culture from blood and cerebral spinal fluid from patients in those countries. And they're really thinking about 8 different bacterial pathogens, which we're often concerned about for antimicrobial resistance. And in the rest of my talk about EARSnet, I'm going to focus on just one of these, Klebsiella pneumoniae. It can cause many different types of invasive infections in humans. And I want to review together with you a couple of different data points from EARSnet on Klebsiella pneumoniae and antimicrobial resistant Klebsiella pneumoniae. We're going to look at the geographic distribution of resistant Klebsiella isolates from across Europe, and then also look at the data that they've produced over changes in time in those resistance patterns. All of these are available on the website. If you want to go and look at all of the pathogens, it's all there, and they have a really fantastic data set. So first, this slide shows us something about the geographic distribution of resistant isolates. When you look at a figure, it's always important to identify the legend and to look at the different axes to orient yourself to the data that are being presented. So first, let's look at the legend, which is at the very bottom, and we have different colors. There's the green, the different shades of gray, and the black. Now, in green, it shows the isolates that are fully susceptible. That means that antibiotics we use for these infections work. Then in various shades of gray through to black, we have increasing resistance to different types of antibiotics. So in the light gray, it shows the isolates that are resistant to one antimicrobial group. And then all the way on the other side in black, it shows the isolates that are resistant to 5 antimicrobial groups, which would be highly, highly resistant. So now let's look at, this is just a portion of the table with a few of the countries that are in EARSnet represented. Along the x-axis, so along the bottom, you see different proportions there from 0 to 100. Those are the percentage of the total. For each country, it's showing us what proportion of the isolates of Klebsiella pneumoniae are susceptible to all antimicrobial groups or resistant to a number of antimicrobial groups. Let's look at one particular example just to make sure we're following how to read these data. Let's look at Hungary here at the bottom. Hungary, that bottom line, shows that of all the isolates submitted from Hungary, more than half, it looks to be about 58%, are fully susceptible to antibiotics. There's a small number that are resistant to just one antimicrobial group, a bit larger proportion, but less than 10% that are resistant to 2 antimicrobial groups. But then we see a large proportion, almost 30%, are resistant to 3 antimicrobial groups. So go through just to be sure that you can read that and understand what the data are saying for Hungary. And so what they've done is arranged countries here by the proportion that are fully susceptible, right? So at the bottom of this list, you would see the countries that have the greatest problems with antimicrobial resistance when it comes to Klebsiella pneumoniae. So we can see here, for example, Germany's at the top. Almost 80% of their isolates were fully susceptible, whereas in Hungary it was less than 60%. Now, let's look at changes over time. So this map is also giving us an overview of geographic distribution of isolates, but we can look at this map and also look at how things have changed over time. So this figure is showing us the percentage of invasive isolates with resistance just to third-generation cephalosporins, fluoroquinolones, and aminoglycosides in 2012. These are the participating countries in EARSnet, here on the left. Again, these data are from 2012. So on the left side, you can see the legend for this map. It starts at the top with green, goes down to dark red, and then you have some gray. And if you look at the legend, the green means that less than 1% of the isolates in 2012 from that country were resistant to these 3 antimicrobials listed in the title. If you go down to the dark red, you see there are a few countries in dark red. That means that more than 50% of the isolates were resistant to those antimicrobials. And then they have some gray with no reported data. That's good for all maps to have some indication of who actually didn't report data. So we're going to compare that with the picture in 2015, which you'll now see on the right side. So the map on the right side also has a legend, but those colors mean exactly the same thing in 2015 as they did in 2012. And that's what allows us to compare these two maps. So when we see the bright green, which really indicates almost no problem with antimicrobial resistance, you can see between 2012 and 2015, there are fewer countries with the bright green. We can also see that there seem to be more countries with red, darker red, countries that have, like Spain, for example, which is yellow, and the 5 to less than 10% in 2012. that has now become orange, which means 10 to 25% of the isolates were resistant. So this seems to suggest that there are more isolates that are resistant in 2015 compared to 2012. Overall, the map is becoming less green and more red. So you can see through this surveillance system how the European Union and the participating countries in the surveillance system are able to use data from the surveillance system to track resistance patterns geographically and over time to help them develop interventions that might be useful and to track the spread of these pathogens and help stop them across Europe.